next to the remaining part of glucocorticoids that I am going to cover today. In last lecture, we have learned about some names of glucocorticoids, topical preparations and inhalational preparations of glucocorticoids, and IV administered glucocorticoids, IM administered glucocorticoids. Then their action over different systems. Main action is they are anti-inflammatory, they suppress immunological response and allergic response. So they are broad spectrum anti-inflammatory, they suppress all type of inflammatory responses. And allergic responses. Mechanism of action, molecular level mechanism of action. They bind with receptor, go inside the nucleus, and mRNA is formed and by transcription, and then specific proteins are synthesized which further let down the different actions inside the body. So receptor, it mainly bind to receptor, glucocorticoid complex bind to the nucleus and protein synthesis occurs, that is the molecular level mechanism of action. Now uses of glucocorticoids, they are used mainly for the replacement therapy, means whenever there is a deficiency of hydrocortisone inside the body, then you can give glucocorticoids or hydrocortisone by injection to the patient as a replacement therapy in acute adrenal insufficiency. In this case, there is a deficient amount of hydrocortisone released inside the body. In that case, to tide over the crisis in acute adrenal insufficiency, you can give glucocorticoids. Chronic adrenal insufficiency, it is a chronic condition. Adrenal gland is insufficient to secrete the glucocorticoids. In such cases, chronically you can give. And congenital adrenal hyperplasia, it is congenital disease when there is a less or none secretion of glucocorticoid. In those cases also glucocorticoids can be given. Now replacement therapy we have learned. Now pharmacotherapy of glucocorticoids. So there are wide uses of glucocorticoid. Remember, uses of glucocorticoid itself is a very important topic. You can get long answer question on the glucocorticoid. In that, uses of glucocorticoids and adverse effects of glucocorticoids are very much important. So pharmacotherapy of glucocorticoid, there are arthritis, collagen diseases, severe allergic reactions, autoimmune diseases, bronchial asthma, other lung diseases, infective diseases, eye diseases, skin diseases, intestinal diseases, cerebral edema, malignancies, organ transplantation and graft, septic shock, thyroid storm. So 15 uses are of glucocorticoids. So let's learn one by one. Arthritis, it is an inflammation of joints. So arthritis can occur in rheumatoid arthritis, osteoarthritis, rheumatic fever or gout. In all these conditions, inflammation of joint occurs. Early line of treatment is NSAIDs, non-steroidal anti-inflammatory drug. If patient is not responding to NSAIDs, in later cases, this glucocorticoid can be given in such conditions. It can be given orally or intra-articular injection of glucocorticoid can be given to the patient. Second use is a collagen disease. In collagen disease, what happens? Body gives the immunological response against the collagen fiber inside the body. So wherever collagen is deposited, it is deposited in subcutaneous tissue, also in arteries, veins. So against those tissues, immunological response is triggered, that is inflammatory type of response. And so disease manifestations occur like nephrotic syndrome. If collagen tissue in kidney are targeted, then nephrotic syndrome occur in patient. Glomerulonephritis can occur. Systemic lupus erythematosus. So systemic affliction of all collagen tissue occur in this case. So in such collagen diseases, there is immunity against collagen fiber of body. To suppress that immunity, In collagen diseases, glucocorticoids are given. Severe allergic reactions. Severe allergic reactions are like pemphigus vulgaris, angioedema, rashes, purpura. In such cases also, allergic conditions, you can give glucocorticoid to tide over the crisis. Then autoimmune disease means body synthesize the body secretes the immunological response against the body's own tissues. That is called as autoimmune disease. So examples of some autoimmune disease in which glucocorticoids are given as a therapy are autoimmune hemolytic anemia, idiopathic thrombocytopenic purpura. So these are some example. You can remember whichever easy to you to remember. Next use is bronchial asthma. So in bronchial asthma, there is a triggering of immunological response against the bronchus. So bronchoconstriction occur and patient is unable to breathe easily. So that's why in bronchial asthma, glucocorticoids are given to achieve the bronchodilation and to decrease the inflammatory response in the bronchus. So bronchial asthma inhalation glucocorticoids can be given, or a systemic injection, IV injection or IM injection of glucocorticoids can be given in the severe cases of bronchial asthma. Then other lung diseases like aspiration pneumonia and pulmonary edema from drowning and late pregnancy cases. So in aspiration pneumonia, there is aspiration of fluid inside the lung alveoli. So due to aspiration of fluid, there will be triggering of inflammatory response to suppress that inflammatory response. In aspiration pneumonia, glucocorticoids are given. Pulmonary edema also it can be given, and in late pregnancy to achieve maturity of fetal lungs, glucocorticoids are given. In infective diseases, in severe infective diseases like septicemias, glucocorticoids are given along with antibiotics. So first antibiotics are given, then and then only in septic shock cases, glucocorticoids are given to suppress the inflammation. Eye diseases, in anterior chamber affliction of eye, conjunctivitis, keratitis, iridocyclitis, in those conditions, glucocorticoids are applied topically. In skin diseases, topical application of glucocorticoid is done in eczematous skin diseases. Systemically, glucocorticoids are given in pemphigus vulgaris or exfoliative dermatitis. So you can just remember eczematous skin diseases, pemphigus vulgaris, exfoliative dermatitis. These are the uses in skin diseases of glucocorticoids. Then intestinal diseases, inflammatory bowel diseases. So here intestinal diseases, in that case you can write down inflammatory bowel disease, IBD or Crohn's disease as a uses of glucocorticoids. In cerebral edema also, to suppress the edema of meninges, glucocorticoids are given in cerebral edema conditions. In malignancies, ALL, acute lymphocytic leukemia, Hodgkin's disease, hormone responsive breast cancer condition. These are some examples of malignancies where glucocorticoids are first line treatment to treat these cancer conditions. ALL, Hodgkin's lymphoma and hormone responsive breast cancer condition. Then organ transplantation and skin allograft. So if you transplant other organ to the body, or you transplant this or you do the skin grafting, then body can trigger inflammatory response against that transplant. So to suppress that immune response and to prevent transplant ejection, glucocorticoids are given in higher doses in this condition. Also in septic shock, glucocorticoids are given to maintain the blood pressure of patient. And also in thyroid storm, these are some uses of glucocorticoid: septic shock, thyroid storm, malignancies, cerebral edema, intestinal diseases, skin diseases, eye diseases, infective diseases, other lung diseases, bronchial asthma, and autoimmune diseases, severe allergy, collagen diseases, and arthritis. So wherever there is a severe inflammation or allergic condition, glucocorticoids are given. So different conditions of diseases, different tissue is afflicted, So different diseases glucocorticoids are given. Adverse effects of glucocorticoid, this is also an important topic because glucocorticoid lead to the various severe adverse effects. Cushing's habitus, you know in first year physiology, Cushing syndrome, there is a puffiness of face, moon face, buffalo hump, fish mouth, then abdominal fat deposition. So these are some signs of Cushing's habitus. Then fragile skin and purplish stria, these are the skin affliction of glucocorticoids. Skin become thin, fragile, and purplish stria over the abdominal skin occurs. Hyperglycemia, glucocorticoid increases the blood sugar level. That's why hyperglycemia causes muscular weakness. So optimal level of glucocorticoids is required to maintain the muscle tone. If it is deficient, then also muscle weakness occurs. If it is a hyper, then catabolic reaction is triggered and muscle weakness occurs. So optimal level is sufficient for glucocorticoid. Excess will lead to muscle weakness. And susceptibility to infection, as glucocorticoids suppress immunological response, patient becomes susceptible to secondary opportunistic infections. Delayed healing of wound. So delayed healing, whenever there is a cut mark or injury to the tissue, there is an initial response is the inflammation, and then after healing at that site occurs. So if you suppress the inflammatory response, that lead to the delayed healing of any wound. Peptic ulceration, glucocorticoid increase gastric acid secretion. That's why in peptic ulcer disease, excessive secretion of gastric hydrochloric acid lead to the peptic ulceration in GI tract. Osteoporosis, glucocorticoids suppress the osteoclast formation, and they decrease the calcium absorption. That's why osteoporosis occurs. Posterior subcapsular cataract. This occurs on chronic therapy of glucocorticoid, or if it is taken for longer duration for years, posterior subcapsular cataract in eye occur. Glaucoma, it is also eye condition. Here there is a rise in intraocular tension of eye. If glucocorticoid can lead to the glaucoma. Growth retardation, glucocorticoid causes the fusion of epiphysis. That's why if it is given in pediatric patients, then they lead to the growth retardation of a child. Then fetal abnormalities, if it is given to the pregnant lady, IUGR occurs. Neurological and behavioral disturbances in fetus can occur. Psychiatric disturbances, glucocorticoid lead to the depression, mood suppression. Higher doses can lead to the delirium. So psychological disturbances can occur with glucocorticoid. Suppression of HPA axis, hypothalamo-pituitary axis, that is a hypothalamo-pituitary axis. Body synthesizes its own glucocorticoid by adrenal glands. If you give external glucocorticoid to that person, that lead to the that triggers the signal to the hypothalamus. Hypothalamus gives suppressive signal to the pituitary gland, and from pituitary gland again give the suppressive signal to the adrenal cortex. So overall synthesis of glucocorticoid by adrenal gland is suppressed. So body stop synthesizing its own glucocorticoid. It become dependent on external glucocorticoid. That is a suppression of hypothalamo-pituitary axis. It is a very serious condition. So if you suddenly withdraw treatment with glucocorticoid, patient may underlodge into the withdrawal symptoms of glucocorticoids. That's why slowly tapering dose of glucocorticoid should be given. Avoid chronic therapy of glucocorticoid. If it is given chronically, then there is a HPA axis suppression. You should slowly taper the dose and slowly stop the treatment with glucocorticoid. So this precaution should be taken if it is given for a chronic condition. So adverse effects are also important of glucocorticoid. Remember, so formulations of glucocorticoid, mechanism of action, uses, and adverse effect. So long question can be asked on glucocorticoids. Now second important topic in CNS is anti-epileptic drugs. Epilepsy is a condition of central nervous system where there is a abnormal firing of brain neurons occur. So normally there is a signal transmission by electric impulse inside the brain. What occurs in epilepsy is that abnormal impulse generation in brain occurs. So that's why different manifestations of epilepsy is there. Grand mal epilepsy is one of the example in which patient lodge into the unconsciousness and he continuously shows the jerky movement of all both hands and both legs, and also there will be tongue thrusting, uprolling of eyes, jerky movement of all over the body, increased tone of the body. So that is one of the example of epilepsy. If such episodes occurs periodically, repeatedly, without any reason, then you term it as a epilepsy. If only single episode occurs without any reason, then you cannot term it as a epilepsy. So epilepsy is a chronic condition, and for that you have to take treatment prophylactically over a period of years. Okay, एकदा epilepsy म्हणजे झटक्याचा आजार. तर एकदा एपिसोड येऊन गेला तर त्याला एपिलिप्सी म्हणायची नाही. जर तो कंटिन्युअसली पेशंटला तसे एपिसोड झटके येत असतील 2-3 महिन्यातून 1-2दा 3दा, तर तुम्ही त्या पेशंटला अँटी इपिलिप्टिक ट्रीटमेंटवर स्विच करता आणि ती ट्रीटमेंट पेशंटला काही वर्षांसाठी घ्यावी लागते आणि मग काही वर्षानंतर हळूहळू जर त्याचे एपिलिप्सी येत नसेल हे पाहून मग त्याचा हळूहळू डोस कमी करून मग शेवटी तो स्टॉप केला जातो. So clonic tonic seizure is one of the example. Absence seizure in that कुठलीही जर्की मुवमेंट होत नाही, फक्त पेशंट ॲब्सेन्स माइंडनेस मध्ये जातो काही मिनिटांसाठी ओनली दॅट. ओके, अँड पार्शल सीजर इज ऑल्सो देअर इन दॅट ओनली वन लिम्ब इज मुव्हिंग. कुठला एक मसल ग्रुप बॉडीचा मूव्ह करत असतो, दॅट इज अ पार्शल सीजर. कारण की ब्रेन मध्ये फक्त एकच फोकस त्यावेळी ट्रिगर झालेला असतो. So depending on the different type of seizure, prophylaxis also differs. Epilepsy is a disorder of brain function characterized by periodic and unpredictable occurrence of seizure. Now, treatment of epilepsy, there are very large list of anti-epileptic drug, and classification is also difficult, but you should remember as it is one of the important topic of CNS. Barbiturates, in that comes phenobarbital, deoxybarbiturate, in that comes the primidone, hydantoin, in that comes the phenytoin, fosphenytoin, imnostilbene, in that comes the carbamazepine, oxcarbazepine, succinamide, in that comes the ethosuximide. Aliphatic carboxylic acids are valproic acid and valproex. Benzodiazepines, clonazepam, diazepam, lorazepam, clobazam. So benzodiazepines are already taught to you. Barbiturate is also already taught to you. That is a sedative hypnotic drug. Phenyltrazine. In phenyltrazine comes the lamotrigine, cyclic analog, GABA analog. GABA is a gamma aminobutyric acid, which is an inhibitory transmitter in CNS. So that's an analog is a gabapentin. So this is the list of drugs used in epilepsy, prophylactic use, and also there are some drugs which are used to treat the status epilepticus acutely. Okay, status epilepticus is a serious condition. त्यावेळी पेशंटचे सीझर अटॅक कुठलाही ड्रग दिला तर स्टॉप होत नाही. दॅट इज टर्म्ड एज स्टेटस एपिलेप्टिकस. त्यामध्ये डिफरंट ड्रग यूज करतात. वी आर गोइंग टू लर्न इट ॲट द एंड ऑफ द लेक्चर. So some prototype drug in treatment of epilepsy, phenytoin. It is a hydantoin group of drug. Mechanism of action, it stabilizes the neuronal membrane. So abnormal firing of neuronal membrane occurs. So phenytoin stabilizes its neuronal membrane to decrease the firing by prolonging inactivated state of voltage gated sodium channels. सोडियम एंट्री जर न्यूरॉन मध्ये झाली तर ते ऍक्शन पोटेन्शियल ट्रिगर करतं आणि त्यातून इम्पल्स पुढे जनरेट होतात. सो टू स्टॉप जनरेटिंग न्यूअर इम्पल्सेस, टू डिक्रीज सोडियम एंट्री इनसाइड, the sodium channels inactivated state मध्ये ठेवले जातात by phenytoin. So mechanism of action is maintain or prolong the inactivated state of sodium channels. Okay, लक्षात ठेवायचं एकच लाईन मध्ये mechanism of action. ह्याचे साइड इफेक्ट्स खूप सारे आहेत, डिफरंट आहेत, पण निमोनिक इज दॅट H5H कुठले, gum hypertrophy, hirsutism, hypersensitivity, hyperglycemia, and fetal hydantoin syndrome. These are main 5H in the adverse effect of phenytoin. Others are megaloblastic anemia, osteomalacia, ataxia, diplopia. If given by IV route, it can lead to the vasculitis. These are the adverse effects of phenytoin. Uses: it is used in as a first line drug in general tonic-clonic seizure, partial seizures, status epilepticus and trigeminal neuralgia. तर हे काही युजेस आहेत. पर्टिक्युलरली तुम्हाला ह्याचे युजेस जर लक्षात राहत नसेल तर तुम्ही सगळी नावं लिहून ठेवा. जे जे एपिलेप्सीचे नाव आहेत, पार्शियल सीझर, जनरलाइज्ड टोनिक-क्लोनिक सीझर, स्टेप्टस एपिलेप्टिकस, ट्रायजेमिनल न्यूरॅल्जिया, जे जे नावं आठवतात, पार्शियल सीझर, कंप्लीट सीझर, जनरलाइज्ड सीझर, तर ते तुम्ही सगळे लिहू शकता. in case of uses of anti-epileptic drugs, phenytoinचे uses, carbamazepamचे uses, valproic acidचे uses. कुठलेही uses असतील तर तुम्ही ॲज अ ब्रॉड टर्म सगळे uses लिहून टाका, जे बरोबर येतील ते येतील. हो ना. So next drug is carbamazepine. It is a broad, it is again the recently used. It is a preferred first line drug for the ट्रीटमेंट ऑफ एपिलेप्सी, कारण की कार्बामॅझेपाइनचे ॲडवर्स इफेक्ट्स फेनिटोइनच्या कम्पेअर्ड किंवा व्हॅल्प्रोइक ॲसिडच्या कम्पेअर्डली कमी आहेत. सो इट इज अ ड्रग ऑफ चॉईस इन pediatric patient, in pregnant ladies. It is a drug of choice because it has lesser side effects. Mechanism of action same, it prolongs the inactivated state of sodium channel. Side effects, lesser side effects are there: sedation, dizziness, vertigo, diplopia, ataxia, hypersensitivity reaction, and water retention. It is used in complex partial seizure, generalized tonic-clonic seizure, simple partial seizure. 2-3 नावं which comes repeatedly in case of uses of epilepsy. It is a drug of choice for trigeminal neuralgia. तुम्हाला ड्रग ऑफ चॉईस म्हणून प्रॅक्टिकलला क्वेश्चन येतो. सो ड्रग ऑफ चॉईस फॉर ट्रायजेमिनल neuralgia is carbamazepine. डोस काय ते तुम्ही जाऊन पाहून करून ठेवा. Then it also used in manic depressive illness and acute mania. Next drug is valproic acid. Valproic acid is a broad spectrum anti-epileptic drug. Valproic acid चे देखील साइड इफेक्ट फेनोटाइन सारखे खूप सारखे आहेत. ह्याची पिक्युलरिटी आहे, इट इज अ ब्रॉड स्पेक्ट्रम अँटी-एपिलेप्टिक ड्रग, कारण की ह्याला तिन्ही मेकॅनिझम असोसिएटेड आहे. इट प्रोलॉंग्स द इनॅक्टिवेटेड स्टेट ऑफ सोडियम चॅनल, इट इनहिबिट T current calcium channel, and it augments GABA release inside the brain. These three mechanisms, हे 3 mechanisms आहेत. बाकी सारे अँटीइपिलेप्टिक मोस्टली हे 3 mechanisms वरती अवलंबून असतात. कुणी फक्त सोडियम चॅनलला इनहिबिट करतं, इथोसुक्सिमाइड फक्त कॅल्शियम चॅनलला इनहिबिट करतं, गाबा ॲनोला गाबा रिलीज करतात. पण व्हॅल्प्रोइक ॲसिडला ह्या तिन्ही ऍक्शन अप्लाय होतात. दॅट्स वाय इट इज अ ब्रॉड स्पेक्ट्रम अँटीइपिलेप्टिक ड्रग. Side effects are anorexia, vomiting, drowsiness, ataxia, tremor, alopecia, curling of hair, rashes, thrombocytopenia. If it is used in pregnancy, it can lead to the spina bifida and neural tube defects in the fetus. So adverse effects of valproic acid are also important. You can get short note on the phenytoin and also short note on the valproic acid. Now it is used in first line drug for the generalized tonic-clonic seizure, partial seizure. It is a drug of choice for myoclonic seizure and absence seizure. Tonic seizure and absence seizure साठी valproic acid is a drug of choice. Again, drug of choice question मध्ये valproic acid for absence seizure and tonic seizure you can write down. So that was about the epilepsy, some drugs, particular drugs of epilepsy. Now treatment of epilepsy. Epilepsy is a chronic condition. Mostly you give the treatment for the as a prophylaxis to prevent future attack in status epilepticus or in current seizure attack. To tide over the current seizure attack, there are different drugs to tide over the crisis, like diazepam, phenobarbital are given acutely to control the seizure attack. According to the type of epilepsy, drug of choice differs. Main aim is to control or prevent the future seizure attack. Early initiation of the therapy is always required. If single episode is there, only that episode is treated, no prophylaxis is given. If the episodes is repeatedly occurring, then you term it as epilepsy and you give anti-epileptic prophylactic treatment to the patient. Maintain the diary, seizure diary of that patient. तुम्हाला ह्या वर्षभरामध्ये कधी कधी एपिलेप्सीचे अटॅक आले होते, किती लवकर येतात किंवा किती प्रोलॉंग टाइमनी येतात, हे सगळं त्या डायरीमध्ये असतं. तुमची ट्रीटमेंट त्यामध्ये लिहिलेली असते. दॅट इज अ सीझर डायरी. तुमची पूर्ण हिस्ट्री असते त्यामध्ये. Then withdrawal of a drug should be after some years, and if there is a no epilepsy attack over the year, then only withdrawal is slowly done. Therapeutic monitoring of antiepileptic drug is required, because if the dose is higher, then the adverse effects are also occur at higher rate. That's why therapeutic monitoring of the antiepileptic drug is required. Treatment in pregnancy is very crucial one, because most of the drugs lead to the severe adverse effect to the fetus. So whichever safer drug that should be chosen, and their dose also be titrated towards the lower side in pregnant lady. So that's all about the treatment of epilepsy. Then there is also again terminology of status epilepticus. It is a repetitive attack of seizure without without any silent period in between. Means in half hour there is continuous 2 or 3 attack of seizures, or over the year the seizure over the 1 hour the seizure attack is not stopping, by it is not responding to any antiepileptic therapy. It is labeled as a status epilepticus. It is an emergency condition, कारण की असेच जर सीझर कंटिन्युअसली पेशंटला विदाउट बिटवीन स्टॉप जर येत राहतील, विदाउट इन बिटवीन सायलेंट पिरियड येत राहतील, तर repetitive seizure can damage the medulla oblongata. It can hamper the cardiovascular center. It can damage the respiratory center, and patient may lodge into the coma and finally death. That's why to control the acute attack of seizure is very much important. In that case, some drugs are given. Those drugs are benzodiazepine, lorazepam, phenytoin, fosphenytoin. If patient is not responding to these drugs, then you can shift the patient to the operation theater and give general anesthetic drugs. So remember, sedative hypnotics, benzodiazepine and lorazepam, phenytoin, fosphenytoin are given acutely to control the acute seizure episode, and also in status epilepticus patient it is a drug of choice. Benzodiazepine, lorazepam, phenytoin and fosphenytoin. And यांना जर respond होत नसेल, then you can give patient general anesthetic drugs to save his life. So that covers glucocorticoids and anti-epileptic drugs. If you have any problem, you can ask. You can unmute. Glucocorticoid and antiepileptic, both topics have been covered in these 2 lectures. One is important topic from hormone or endocrine, and second is important topic from CNS. Antiepileptic drugs you can mostly get short note, not a long answer question. Glucocorticoid you can get long answer question. So no queries, you can unmute your devices, you can ask me questions. If you have no question, then I declare both topic are over. Okay.